I want to touch on side gliding of the lumbar spine or low back briefly. This is not a technique description. Robin McKenzie's book, Treat Your Own Back, has thorough instructions on what to do. What I want to point out is something that I've noticed with patients recently. Side gliding as a repeated movement test can be used for people who have central low back, across the low back, or any symptoms in the lower extremities. It's something we usually get to for people who have asymmetrical symptoms. For example, left knee pain greater than right, or if they only have one-sided symptoms, like pain only on the right side. But these are not hard and fast rules. At the end of the day, repeated movement testing is very cause and effect. You take the range of motion, you take the strength, you take the nerve tension, you take a functional baseline, you do a repeated movement test, say 10 repetitions, 15 repetitions, 20, and then you retest those baselines. So the proof is right in front of you. You get 3 options. Is it worse, better, or about the same? And there are different modes or different ways to continue based on whether or not it's worse, better, or about the same. Nonetheless, what I've noticed is that I'll have a patient, say, with left-sided dominant symptoms, and I'll put them against the wall to start the repeated movement test of left low back side gliding, and they'll look at me and ask me if they're sure or if I'm sure I'm doing it the right way. Because patients are so ingrained to believe that the key to orthopedic treatment is stretching. So they'll go into the left side glide and they'll feel the stretch in the right QL, the right obliques on that right side. And they know that their symptoms are more on the left, so they don't feel like it adds up. And I have to explain to them, I know you feel a stretch on the right tissue. That means we're getting to end range. That's what we want, that strain. But the point of this movement is to attack or to hit the left side of the low back joints. We're performing a gliding motion, and I know the word attack is a bit vague, but we're pushing from the left side toward midline. Just like extension of the low back is pushing from the posterior aspect toward midline, toward the anterior part of the spine. And flexion is the opposite. If I flex, I'm applying a force anteriorly that pushes posteriorly. So we can envision that kind of phenomenon when we think about what we're trying to do with the spine regarding symptoms. For people who have problems on the left side, what I want to see is if pushing things back towards the midline is effective. So don't think about stretching all the time in orthopedics. Joint mobilizations, patients are receiving them and clinicians are doing them all the time. This is a self-mobilization. If I need to add more force, of course, I can use my hands to apply a more kind of specific mobilization. But when I use side glides, most patients can achieve what they need to achieve independently. But joint mobilizations and joint kind of centric treatments on the whole make up the bulk of what I think orthopedics needs to be. And we need to kind of rethink how everything needs to be about strengthening muscles and stretching muscles.